So very conservative hairline. So we can look at here. Basically, patient has lost hair over this area. So within 1,200 gram, very limited graft because it's budget, and also doctor wants to do a very conservative treatment for him. So just creating a new hairline, adding in hair at both the temporal angles is lost. There's no need to do any hair restoration over this area. Patient has been coming for consultation for 3 years, save his money to do this procedure. So I'd like to congratulate my patient who actually has his mindset of doing this procedure and actually has patience to wait so that he could do this procedure, save the money. Every month he saves some money. So we will plan your journey in the sense of when you can do it, how you can do it, how the minimum number of grafts you can do it, and then how to follow your budget. So we are here to help all of you, those who actually is having hair loss issue. So thank you again. I'd like to thank my patient for choosing Clinic Dr. Inder to do his hair restoration. Thumbs up.